Welcome to the RX Physiotherapy Podcast, your go-to destination for all things physio, rehab, health and wellness. I'm April Patterson.
And Trent.
And each week, we will dive deep into fascinating topics within the health world, from physiotherapy to nutrition and beyond. We cover it all. So sit back, relax, and enjoy the journey as we explore the exciting world of health and wellness. Let's get started.
An ACL injury doesn't just injure your knee. It hijacks your future. One step, one landing, one cut. And suddenly everyone has an opinion. You're here, you'll definitely need surgery. Your season's done. Your knee will never be the same. But here's the first important truth. None of that can be decided in the first few days. Research consistently shows that early panic leads to rushed decisions, and rushed decisions don't improve outcomes. This episode is about slowing the process down, understanding what actually happened, and mapping what comes next, based on evidence and not fear. G'day, my name's Trent Cooksley, one of the physiotherapists here at RX Physiotherapy, and this is going to be the first of a couple episodes over ACL injuries and kind of the rehab processes that are currently available. So, what is the ACL actually responsible for? The ACL is often misunderstood. It doesn't exist to, quote unquote, hold the knee together. Biomechanical work by Butler, Noyes, and Grood demonstrate that the ACL primarily resists anterior tibial translation and rotational loads during pivoting. But this matters because the ACL is only one part of a larger system. Muscle strength, timing, coordination, and trunk control play a massive role in knee stability. This explains a key clinical observation because some people with a torn ACL function extremely well, whilst others sometimes don't. The ligament alone doesn't define the outcome. So how do ACL injuries kind of actually occur? So for years, ACL injuries were blamed on bad luck. Then came video analysis, especially in a landmark study by Koja et al. In 2010, analyzing real ACL injuries frame by frame during sport. They found the injuries generally occurred within 40 to 50 milliseconds of foot contact. The knee is often close to extension, and it's also combined with valgus and rotational forces that are present within the knee. This tells us something quite crucial. ACL injuries are pre-programmed by movement patterns, fatigue, and load exposure, not random accidents, which means rehab can meaningfully change future risk. So what kind of looks like immediate management, what actually kind of matters early. After an ACL injury, the priorities are kind of often wrong. The evidence doesn't support immediate surgical decisions, prolonged immobilization, or complete rest. But studies by Etzen and Grimden show that early focus on swelling reduction, restoring knee extension, quadricep activation is often linked to better long-term outcomes with or without surgery. This is why modern protocols like the maybe Melbourne ACL Rehabilitation Guide 2.0 now come in. So the Melbourne group emphasise early weight bearing, early strength work, delayed decision making. Not because surgery is bad, but because rehab provides information. Like a surgery versus non-surgery, why usually these decisions are not based off day one thinking. Here's where we need to pause and challenge the old way of thinking. So in 2010, Frobel, and colleagues published a landmark paper in the New England Journal of Medicine. They compared early ACL reconstruction and structured rehab with the optional delay of surgery, and that both 2 and 5 year follow-ups, there was no difference in outcomes between the groups. And crucially, around 50% patients never needed surgery. This study changed global ACL thinking, and it showed that rehab first is not an inferior care, it is informed care. One of the main questions is can you return to sport after an ACL injury? And this is a question that every athlete that I've seen with an ACL always asks. And the honest answer is an overall yes, but how you return matters more than whether you've had surgery or not. So work by Grindam and colleagues showed that athletes who restored quadriceps strength before returning to sport had a significant lower re-injury rate. Meanwhile, Paterno et al. Found that young athletes returning too early faced a dramatically increased risk of a second ACL injury. So return to sport is not about timelines. It's about strength, capacity, confidence, and exposure. Now, kind of trying to start reframing the ACL conversation, and let's try and land it quite clearly. An ACL injury is not a career death sentence. It's not an automatic surgery, and it's not something you should rush. The evidence is clear. Rehab matters, strength matters, and decisions improve with time. The knee you build after an ACL injury can be stronger, more resilient, and more prepared than the one you had before, if the process is respected. Now, in the next episode, we'll go deeper into the surgery versus non-surgical decision and how to know which path actually suits you. So, hopefully you've learned something a little bit today from today's podcast, and hopefully you enjoy listening to my lovely voice, and I will catch you in the next kind of couple episodes about the ACL. Cheers.